So in the context of Kenya, the OGP could not have come at a better time because it started in 2011, just after the promulgation of the Kenyan constitution in 2010. So the Kenyan government was very quick to adopt it and made 8 commitments towards achieving open governance. And right after that, in 2016, of course, the promulgation of the constitution brought about a devolved system of government. So here in Kenya, we have 47 governments, county governments, and so far only 4 of them out of 47 have actually joined the OGP. The first one being Elgeyo Marakwet, which joined in 2016, followed by Nairobi, which is the capital city of Kenya, Makueni and Nandi counties. So in total, there are 4. So you see, we still have a very long way to go to achieve all 47 county governments having or joining the OGP. So I'll talk about a little bit about the legal framework because we are all governed by the law. So we have laws that are enforcing principles of public participation, open governance, and open data. So I've just mentioned the Constitution of Kenya. We also have an Access to Information Act. Counties have gone as far as developing their own public participation policies. On a national level, we also have the Kenya Health Policy, which is a long-term plan that gives direction for healthcare reforms that is set between 2014 and 2030. So it's a document, a policy document that we're still implementing. When it comes to the county level, because health is a devolved function, every county government is responsible for promotion of primary healthcare. So it's moved from being managed from a national level to a county level, which I think has contributed to the spread of, or the equitable spread of resources to the marginalized areas here in Kenya. So again, on a county level, we also have other long-term plans, the County Integrated Development Plan, which basically sets the precedents for 5 years for how plans and projects for healthcare and amongst other sectors will have been outlaid. And then consequently or subsequently, we have the budget estimates that are done annually, which need to speak to the plans that are already in place. So if we see that the healthcare plans in the planning documents, we expect that there's subsequent allocation of resources to ensure that these plans are actually executed. So I talked about the public participation policies for the counties. Although they are there, we recently conducted a survey in collaboration with the International Budget Partnership Kenya. It's called the County Budget Transparency Survey. I've been able to participate in that 2 years in a row. And the whole gist of the survey is to evaluate whether counties are being transparent and whether they're giving out information, budget information in a timely and in a comprehensive manner. And the most interesting thing that came out was that the OGP implementing counties, which are 4, are not necessarily the top most transparent counties. That has brought a very interesting aspect to it. A county like Nyeri was actually came out on top, and they are not OGP local implementing partners. So that just goes to show you that it's important to have political goodwill because leaders in those counties are very proactive and they want to restore trust in government by their citizens, because a lot of citizens do not trust the Kenyan government. In fact, lately I've been finding myself in situations whereby I'm compelling my peers, my colleagues, my family to vote because our elections are upcoming. They're going to be on the 9th of August this year. So because of a lot of misappropriation of public funds, for instance, when COVID hit Kenya, we had a very huge scandal. The Kenya Medical Supplies Agency, which was primarily a state agency that is tasked to distribute medical supplies, a lot of cash was misappropriated. And also, by the time we were doing the first research for COVID incidents in Kenya, about 97% of medical equipment for mitigating COVID-19 was still in the warehouse. And they had actually acquired those supplies at a very high rate. And by the time these things were supposed to be disbursed, more supplies had come into the country, and therefore they went into a loss. So there's been a lot of misappropriation of COVID funds. And the reason we decided to form coalitions, especially with CSOs, was to merge our efforts, because there are very many CSOs here in Kenya who are also tracking COVID-19 funds. So we saw it fit to come together so that our impact is greater. And we've seen a lot of response from government from that. I also need to mention that how the national action plans in Kenya are set up, it's a collaboration between the government and CSOs. That is very commendable. I was so pleased to see that. So you'll find that according to the different commitments, for instance, on beneficial ownership, you'll find like TI has been tasked to be in the committee of implementing that. So I like the fact that the government is now having partnerships with CSOs, as opposed to back in the day whereby they felt like CSOs are just out here to witch hunt and make them look bad. Now we are getting to see county governments and the national government alike partnering with CSOs. So in our quest, during the first phase of CTAP, we were able to go to a couple of counties. Due to strained resources, we were able to go to 6 out of 47 counties. And we chose these counties according to the counties that had the highest rate of COVID-19 cases and those that had the lowest cases, so that we can get some disparity and see the difference between the two aspects. And of course, we were met in one particular county government, we were met with a lot of hostility. In fact, we were not able to get any interviews or even to visit any facilities. They were totally against it. But when you go to a county like Kisumu County, we actually visited one health facility there, public health facility, and we were able to see an oxygen plant. And when you look at implementation reports by the controller of budget, what was allocated for the oxygen plant, you can see it on the ground, because that oxygen plant not only serves the particular hospital, but also hospitals within the same vicinity and hospitals outside of that particular county. So it was good to see that money is actually being put into good use in some counties. So we've also, we know that the health sector is one of the most heavily funded sectors here in our country. So that just goes to tell you that we need to be very vigilant when it comes to monitoring the use of these resources. So some of these things that have been set aside, the policies and procedures that have been set aside for the healthcare sector, primarily marginalized communities or those that are considered disadvantaged really rely on public services. So we need to ensure that these resources that are set aside actually go to the intended purposes. So in our research, we discovered or uncovered that there was a lot of inadequate information on COVID-19 expenditure. I come from Nairobi County, and that is one of the counties that did not present any at all. They've never presented any expenditure information on COVID-19. That is very serious because we do not know how this money is being utilized. Amongst other things, we found out that there was a lot of flaunting of procurement procedures and practices. For instance, we have a universal healthcare program. When COVID hit the country, the Ministry of Health decided to utilize some of that money into COVID funds, which is totally against our Public Finance Management Act. We also uncovered that there was limited public participation, and the reason behind this was the fact that there was cessation of movement. So to contain the spread of the virus, those restriction of movement. But what we did as Follow the Money Kenya, we started doing virtual engagements. And that is what actually yielded a platform called KE Budget Talk, whereby we break down the budgeting process and also keep the public abreast of what is happening in terms of the budget process. Also, we found out that there was lack of non-financial data. it's one thing to allocate resources towards a particular department, but we need to know who is benefiting from these services. We need to know how many men are getting treated in these health facilities, how many women, persons with disability being included, and so forth. So that kind of information was very difficult to retrieve. We also found out that there was lack of centralized data on management of COVID-19 resources. You have to look at a couple of documents for you to make sense of how this money is moving, from the planning process to the budgeting process, up to the absorption process, and how these services are being delivered in the counties. Yeah, so what we intend to do as a CTAP project, by collaborating with the OGP Secretariat. Currently, I think they are undergoing some elections. 3 members, their term was up, so they need to get new people on board. So it would not be fit for us to, it would be very premature for us to engage them right now. So we are planning to engage them right after the new administration is set up. So that is a huge opportunity that we intend to grab. And then also there are these county integrated development plans, which are long-term plans for the counties. The process of formulation is upcoming. We intend to also be part of that conversation. The National Action Plan under the OGP is up. It was between 2020 and 2022. So that's another opportunity to ensure that healthcare accountability is actually adopted in those documents. Then also we need to have engagement with the Council of Governors. They are basically the captains of the county ships. So if we can get through to them to embrace OGP, I think it's going to go a long way. Also, we need to capitalize on existing structures. Like I mentioned earlier, we have public participation policies. The issue is just implementation. If we can carry out a lot of advocacy to compel the government to implement the activities in those policies, I think it will go a long way.